Hello, today we're at North Central Baptist Hospital and we're here with Michael and Dawn, and we're going to be talking about asthma and asthma education. One of the most important things with asthma is that asthma is really, it's about inflammation in the airways, which we'll talk about later, but really it's about education and communication, because once the parents and the patients understand what's going on, it makes the asthma so much easier to treat, and everyone knows what we're doing, why we're doing it. So we're going to break this down into a couple sections. We're going to talk about a general overview of asthma. We're going to talk about what asthma is, how we treat it, and what you should expect in the long term. In the old days, when I was a kid, if you had asthma, you had to sit on the sideline with your puffer, and that was all you can do. And you just kind of did what you could, and that was it. These days, if you have asthma, there's no reason you shouldn't be an Olympic athlete. So if you or your child has a God-given talent to be a gold medalist and their asthma slows them down, then it means either I'm not doing my job giving them the right medicine, or you're not doing your job being sure they're taking it like they're supposed to. Almost without exception. In fact, most kids these days who have asthma that's well controlled, they hardly ever need to use their rescue inhaler. The goal of asthma isn't just to be better, it's to be normal. And kids with normal lungs can run and play full speed with their friends and enjoy life, and that's really what it's all about. There's about 32 different flavors of asthma. You see, most parents think of asthma that they had as a kid or that their friends had, and they think, well, that's just the way it's supposed to be. But asthma is really, it's a whole spectrum. And parents oftentimes come in with their arms crossed and they say, well, my kid has this coughing and wheezing. He doesn't have what my friend had in high school, so that's not asthma. But really it is. So what I always tell parents is that there's about 32 different flavors of asthma. It's like going to Baskin-Robbins and getting ice cream, right? There's lots of different flavors of ice cream, but at the end of the day, it's all ice cream. So with asthma, the main problem that we'll get to here in a second, actually we can just do it right now. The main problem is inflammation. And no matter which type of asthma you have, it affects your small and your medium airways. And normally the walls of the airways are nice and thin, the airway's nice and open, and it's really easy to get the air in and out. But with asthma of any kind, whether it's allergy-induced, exercise-induced, viral-induced wheezing, cough variant asthma, whatever, the main problem is that you get lots of swelling and inflammation in the walls of the airways. And that makes the opening a lot smaller, so it's hard to get the air in, and it's especially hard to get the air out. And that's where the wheezing comes from. And as if that's not enough, when you have swelling and inflammation, you get lots of mucus, and that clogs up your airways even more. So that's two things that can make it hard to breathe. And sometimes when your child has a deep, wet cough, that's that mucus that they're coughing up from down there. So that's two things. And then as if that's not enough, you also have these muscles on the outside that are normally nice and relaxed. But when there's lots of swelling and inflammation and redness and mucus going on, these muscles on top get real irritable and twitchy, and they want to squeeze down and clamp off the airways even more. So that's three things that make it hard to breathe. So when your child takes albuterol or Xopenex, and Xopenex is just fancy albuterol. It's actually exactly the same molecule. So you say Xopenex, I say albuterol, it doesn't matter. Same thing. That's your rescue medicine. When you take albuterol or Xopenex, it relaxes those muscles. But that's all it does. It doesn't do anything at all for the swelling and inflammation and redness and mucus, nothing. And like we said, that's where the main problem is, because if it wasn't for that, those muscles on top wouldn't be so irritable and twitchy to begin with. So how do we treat that? Well, that's where the prevention medicines come in. And these are things, basically everything that we have other than albuterol and Xopenex. So these are medicines like your inhaled steroids, or there's combination medicines with an inhaled steroid and a long-acting beta agonist. I don't want to get into the specific names because these change, every few years as new medicines come out. And then there's also other medicines that work in a different pathway as well. And your doctor will go over this with you personally. But the bottom line is that they're all about prevention. And the way that these medicines work, like the inhaled steroids, like Flovent, Qvar, Alvesco, and then the combination medicines like Advair, Dulera, Symbicort, those are just some of them. And don't get hung up on the names because they'll probably change here as the years go by. But the way they work is you inhale them, and they land here, and they work here, but it doesn't work right away. It takes about 2 weeks for these prevention medicines to kick in, and it takes about 4 to 6 weeks to get the full effect. And what happens during that time is the airways go from looking like this to more like this. And then when you get a cold or the flu or your allergies act up or something triggers your asthma, you're starting off here rather than starting off here. So you have a lot more room to work with before you start coughing, wheezing, getting chest tightness, shortness of breath. So it's all about prevention, and it doesn't take a lot of medicine, just a little bit on a daily basis to keep it controlled. And I, for one, I don't want my kids or anybody else's kids taking more medicine than they absolutely need. And that's one way that parents and I work in direct partnership, is because we are definitely on the same page when it comes to that. So everything in life is about technique. If you use the right technique, things work great, right? If you play for the San Antonio Spurs and you shoot free throws with the right technique, you got a good chance of it going in. If you don't use the right technique, it's a lot harder, for the ball to go where it's supposed to. And the same is true with medicines. If you use the right technique, things work great. If you don't use the right technique, it might work, but doesn't work nearly as well as it should. So in the old days, we thought that the nebulizers worked best, and they do work really well. But we know now that if you use a puffer with a spacer, with the right technique, it works just as well or even better than a nebulizer. In fact, in some emergency rooms, we don't even use the nebulizers anymore for rescue treatments because the puffer with the spacer works just as well or even better for most people. So how do you use it? Well, I have a saying, never a puffer without a spacer, because if you put the puffer straight in your mouth, almost all the medicine gets in your mouth, and some of it gets to your lungs, but you taste it and you swallow it and it goes to your stomach, and very little gets where it's supposed to. So the way it works is first you have to shake it up for about 30 seconds. It's like a miniature spray paint can. The more you shake it, the better. So you shake it up and you put it in here and you puff it, and when you puff it, the medicine comes out in these big fat droplets, and the spacer lets those big fat droplets turn into this fine mist, and that fine mist can get into the small parts of your lungs where the asthma is. So the way that you have to do it is when you shake it up and you puff, you have to breathe in nice and slowly so the medicine can get in your lungs. A lot of the spacers have a little whistle mechanism, and a lot of times kids think it's supposed to whistle. It's not. So I tell kids it's like a police officer blowing the whistle, telling them they're speeding. And the way I explain it is that when you breathe in, the medicine has to go through the spacer and through your mouth, and when it gets to the back of your throat, it has to make a sharp corner to get down in your lungs. And if you're breathing too fast, it's like cars and trucks going down the road too fast. What happens when they get to a sharp corner and they're going too fast? They crash, right? And so every kid gets that. And so you have to breathe in nice and slowly so the medicine can make that corner without crashing. And then you hold your breath for about 10 seconds to let it settle out in your lungs. And then you let it out. And then you shake it up and puff. Do it again. Big, slow, deep breath in. Hold it for 10 seconds and let it out. That's the technique we use for kids that are usually about 7, 8 or so, and adults. Even adults should use spacers, by the way. It works so much better. For younger kids who are less than 7 or 8, or kids that just can't cooperate with it, we'll use a different technique. We'll use a spacer with the mask, like this. So you shake it up like this or like this. You shake it up for about 30 seconds, and you puff, and you have a nice tight seal, and you let the child breathe back and forth about 6 or 8 times. And those 6 or 8 breaths get all the medicine out of the spacer. And you'll see this little one-way valve here open and close each time. So shake it up, puff, 6 or 8 breaths. Shake it up, puff, another 6 or 8 breaths, and you're done. So that's really important. A lot of times the doctors don't go over that, and they just assume the pharmacist might, and the pharmacist assumes someone else does it. And so if you don't use the right technique, it doesn't work nearly as well as it should. Plus, when you use the right technique and it lands in your lungs, you get the most benefit, and then you can use less medicine. Here in the hospital, we're very fortunate because the respiratory therapists will be coming to your bedside, and they'll be showing you exactly how to use this every time, so that by the time you go home, you'll be very comfortable using puffer with the spacer or whatever other treatments that you're taking. What else do you guys want to talk about? We should probably talk about allergies too. In the old days, we didn't think that allergies were that important, but now we know that allergies and asthma go hand in hand, because it's all the same airway from your nose down to your lungs. And whatever causes swelling and inflammation and mucus up here can cause swelling and inflammation and mucus in your lungs. So if your allergies are triggering your asthma, by controlling the allergies, it makes the asthma easier to control. So it's important for anyone who needs daily controller medicines to be evaluated for allergies to see what they're allergic to, either the blood test or the skin test with the allergist. And then you can take steps to avoid those triggers, things like dust mites, cockroaches, cats, dogs, changes in the weather, like the mountain cedar that we have right now, or oak or ragweed, what have you. And there's certain steps you can take and that you'll have to go over in detail with your doctor about how to avoid those things. That's critically important, because by controlling the allergies, then you can use less asthma medicine to keep your asthma controlled. There's other things that can trigger asthma too, things like smoke exposure, fumes, there's industrial things around the house, or exhaust from cars and trucks that's close by. That can also trigger asthma. Even perfume, strong scented candles, those things too. One of the hardest things is smoke exposure. If there's a family member that smokes, even if they smoke outside, the smoke still sticks to their clothes and comes inside the house. And even though they smoke outside, there's still the secondhand smoke or thirdhand smoke is still significant and can really trigger their kids' asthma. So for parents that smoke, if they can quit smoking, that's one of the most important things they can ever do for their child's health. So what is asthma control? We talked about running and playing full speed. By definition, if your asthma is controlled, you should need your rescue inhaler less than twice a week. So your albuterol or Xopenex, you should hardly ever need it. It should be less than twice a week tops. You should have a nighttime cough less than twice a month. And you should need those oral steroids like prednisone less than twice a year. We'll spot you, one round of prednisone a year in case you get a really bad cold or the flu or something. But other than that, it means either I'm not doing my job giving you the right medicine, or you're not doing your job taking it like you're supposed to. And then for kids, they should really be running and playing full speed without any limitations. That's really the goal. So the goal of asthma is control. And when your asthma is controlled, you should be taking your medicines every day. For a lot of those medicines, you do it twice a day, every day, rain or shine. Some medicines are just once a day. And one of the hardest things about asthma is remembering to take your medicines when you're doing well. Because when you're doing well, it's not bothering you. And you've got, school and friends and work and family. You have lots of things going on, and you don't have time to think about taking your controller medicines. So one of the most important things that keeps people out of the hospital and out of the emergency room, and it's probably one of the most important things that we talk about in asthma education, is a way to remember to take your medicine every day. If you keep the medicine in the kitchen cabinet or on the dresser, you have to remember, and life gets busy. And no matter who you are, how great of a parent you are, you just forget. It just happens. And then a couple of days go by, and you think you might be doing okay without your medicine, and you say, oh, that doctor doesn't know what they're talking about. My kid doesn't need this medicine. And just like it takes about 2 weeks for the medicines to kick in, it takes about 4 to 6 weeks to get the full effect. Well, when you stop the medicines, the controller medicines, your symptoms don't come back right away. It takes about a few weeks for that swelling and inflammation to gradually sneak back up on you, and you don't even notice it because it's so mild. And you might do okay for a month or two, but then when you get a cold or the flu or your allergies act up or something triggers your asthma, wham, that's when you get an asthma attack, and then you're back at square one in the emergency room. So that's probably the most important thing, is to find a way in your routine to remember to take your medicines without having to think about it. Probably the single thing that I recommend that helps more people more than anything else is to take your controller medicine and your spacer and rubber band it to your toothpaste. Because you have to brush your teeth twice a day, right? And at least you're supposed to. And so in the morning you do 2 puffs and then you brush your teeth. And at night you do 2 puffs and brush your teeth. That way it puts it on autopilot, so you don't even have to think about it. And with these inhaled steroids, for example, you always need to rinse your mouth or brush your teeth afterwards anyway, so you get 2 birds with 1 stone that way. And that rubber band idea, like I said, keeps more people out of the hospital than anything else that I do. And that leads us to your asthma action plan. And everyone should have an asthma action plan. If your medicines change, your doctor should give you a new one at that visit. And I like to give about 4 copies of the asthma action plan. I want you to keep 1 copy on the fridge, so everybody in the household knows what's going on, what medicines they're supposed to be taking. And then we give a 2nd copy, usually for the school nurse, so that they can be on the same page. We give another copy so that mom can put it in her purse and always have it, or they can tape it to the bathroom mirror if they want to. And then another copy for grandma's fridge. So everybody's on the same page, and it's critically important. So feel free to make multiple copies of this. The first section on your asthma action plan is your green zone, and that's when you're doing well. And that's when you take your controller medicines, usually twice a day, every day, rain or shine, no matter what, till you and your doctor sit down and talk about it otherwise. And with that, you should be running and playing full speed, not having any problems, no nighttime coughing, not hardly ever needing to use your rescue inhaler. And most people think asthma attacks come on over like one day. But really, if you know what to look for, you'll realize that asthma attacks usually come on over 2 to 3 days. And the first day, you might see that your child's starting to come down with a stuffy nose, or maybe their allergies are starting to act up. And you can't always put your finger on it and say, oh, look, there it is. But as a parent, you have the intuition, and you can tell, you know there's something going on. That's the first day. You don't have to give your child the rescue inhaler then, but I want you to pay really close attention, because usually the next day or two is when they'll start having coughing, wheezing, chest tightness, working harder to breathe. They look a little more out of breath when they run up to come to see you. That's when you use your rescue inhaler, the albuterol or the Xopenex, either the puffer with the spacer or the nebulizer, whichever you prefer, whichever seems to work best for you and your household. And you can use that rescue medicine every 3 to 4 hours as needed. If you're not having symptoms, no chest tightness, coughing, you don't necessarily need to give it. But if you're having those symptoms, that's definitely when you give it. And so you can take the medicine every 3 to 4 hours. Some doctors will say even every 2 hours. Talk to your doctor about that in certain situations. But you do that every 3 to 4 hours for about 24, 48 hours or so. If the asthma attack is mild, it should go away by then. If it's not, if you're still needing to use your rescue treatments that often or even more frequently, and if your symptoms are getting worse and not better, that's when you move to the red zone. And your asthma action plan will have specific instructions, but that's when you need to talk to your doctor about starting the oral steroids. That's maybe when you might have to go to the emergency room or seek urgent care. And so forth. So, and when you're in the red zone, basically you do not pass go. Go straight to the doctor's office or the ER. So that's what the asthma action plan is all about. Now, like we said at the beginning, I don't want my kids or anybody else's kids taking more medicine than they absolutely need. So the goal of asthma is control, and the way we treat asthma is like steps. So if you're doing really great on a certain level of medication therapy, and if you do great for about 3 months, then when you see your doctor should be able to decrease your medicine. Because you can get asthma at any age, and you can outgrow it at any age. And I'm not going to tell you to take this medicine until you're 80, because what if you outgrow it in the next year or two? So based on the asthma guidelines, if you do great for 3 months, we'll step it down again. And at some point, one of two things will happen. Either if your asthma is up to here and we step down and your asthma all of a sudden is not as controlled, then you talk to your doctor and you say, you know what, I'm glad you tried to decrease my dose, but my symptoms are coming back. I'm getting chest tightness when I run and play. Have to come back up. Okay, we know that that's where you need to be. And maybe in 6 months we'll try it again, but for now that's really the level of asthma control that you need. But on the other hand, if you're outgrowing, or if your child's outgrowing their asthma and we can step down and get down to the lowest dose and still do great, then at some point we could even stop the medications. The main take-home message, though, is that the controller medicines are something you do every day, rain or shine, no matter what. You don't just use the controller medicines just when you have symptoms. A lot of people say that your controller, or that the rescue medicines, like the albuterol and Xopenex, those things, you can think of those like they're a fire extinguisher, or the albuterol and Xopenex, that's your 911 medicine. You don't call 911 every day, right? Just when you have an emergency. And so if you're needing your rescue inhalers more than twice a week, you really need to talk to your doctor. If your asthma is hard to control, there's other things that you should look at too. We talked earlier about having allergies and how allergies makes it hard to control asthma, and controlling your allergies makes the asthma easier to control. Other things you need to talk to your doctor about are if your child has chronic sinusitis, or if they have obstructive sleep apnea, which is becoming more and more common these days, or if they have gastroesophageal reflux disease or heartburn. If those things are untreated, they can really make the asthma a lot harder to control. And one of the really fun things to do is that if you have a patient who has really difficult to control asthma, the studies show that once you control their allergies, control their chronic sinus infections, control their sleep apnea and their reflux, that actually the asthma is pretty easy to control. And you can use a lot less medicine. So it's really important to have that conversation with your doctor. Just want to reiterate that when you are talking to the respiratory therapist in the room in the hospital, to really be sure to ask your RT all of your questions, and to ask the doctor all your questions when they come in, because they're really a valuable resource for you.